InnoStars Talks is a series of insightful discussions with inspiring health innovators brought to you by EIT Health in collaboration with Emerging Europe, a management advisory and the premier source of English language business information about the region.
So today I am joined by Mate Balazs Kovacs, who is one of the founders and also the CEO of a company called AIP Labs. Mate, welcome to InnoStars Talks.
Thank you, Andrew. Thanks for having me.
Fantastic. So before we take a deep dive into your company, into your organization, I want to start by asking you a couple of questions related to the problem that you started your operations with, and that is skin diseases. And I have a feeling that we don't normally understand how much of a problem skin diseases are, do we?
I guess that people, if you select random people on the street, very few will tell you that dermatology is the third most sought after care type, globally speaking. If you look at the data from private or public insurance companies, there is gynecology, orthopedic examinations, and then there's dermatology. So that would mean that roughly 10% of the population has to visit in person a dermatologist. So there's a lot of annual visits, and unfortunately, in most of the world, it takes 3 to 6 months to get a dermatologist. So, like that would be the starting point when we talk about AIP Derm, which is our AI-enabled digital hospital to treat patients remotely. And 72% of the patients that we receive in this digital hospital actually avoid having to incur an in-person visit, which is the basis of our philosophy, to reduce the time spent on unnecessary visits, to make sure that we can prioritize those who really need care. And on a macro level, our vision is shaped by the fact that in roughly 10 years, there is going to be 10 million people missing from the professional healthcare market, from sorry.
You mean doctors?
Healthcare. Yeah, I mean doctors, and also just healthcare professionals in general. I mean also nurses and other assistants that participate in healthcare delivery. So we are not big believers in the fact that AI can replace doctors. We are always focusing on supercharging doctors' ability to attend to patients and trying to use as much automation and AI tools to make the procedure so seamless that instead of treating 4 or 5 patients per hour, doctors can attend to 30, 40 patients, which is, just going back to 2 sentences, is the biggest problem, the shortage of doctors and healthcare professionals. We are trying to fix that. So that's the problem we are fixing.
So tell me how you managed to convince those medical professionals to actually use AI as well, because from my experience, I can say that they're not always particularly eager to make use of those new technologies.
I think that you need to really understand how doctors think about the world, about themselves, how they got there they are. And it's like I spent the first 2 years just really working with doctors to build the product and the technology that they will be very happy to use. And obviously, if you are coming at them from the angle that you want to replace doctors, you're not going to succeed. Currently, we are working with over 40 dermatologists in 3 countries, plus some international advisors, and we learn how to maximize the potential that's at the intersection of healthcare and technology. So we're not trying to be better at the specific thing that they are really good at. We are just trying to help them to avoid any type of mistakes, to increase their confidence at attending large number of cases online, remotely. And it's a process. At the beginning, I had to find very smart ways of demonstrating that, 1, we have good intentions, and 2, that our technology works, it helps them. And then a couple months into our national pilot that we ran in Hungary, where it was available for all the general population, doctors came back and told me, "Oh, Matt, I really see that the AI is learning. We haven't even updated the algos at that point." But they grew to like the product more, and it became more intuitive. And then 10 out of 9 times, they accept the first or the second alternative, the differential diagnosis offered by the AI algorithm. There was at one point, and it was coming from a doctor outside of dermatology. It was a cardiologist who told me at the beginning, Mate, if you want to create an AI tool that doctors will actually use, you have to understand that there's 100% integration necessary. There's no such thing like 99%. It has to be 100%. It has to be following the same workflow or has to replace the previous workflow. And I cannot use another screen. It has to be integrated. So that's why we decided that the first thing that we do is understand how the electronic health record system work in any given market, in any given hospital where we are operating. And we prevent doctors from having to work twice. We are reducing the time spent administratively. And all of these things that are improving the quality of life for the dermatologist make them more likely to accept also the AI part. And then on the other hand, you have to understand that we are at the, say, cutting edge of technology in medicine. So that offers a lot of potential for the derms that are working with us to publish scientific papers. And that's another angle where you can find ways to make them ease into this type of collaboration.
So now let's take a look at the platform from a patient perspective. So obviously, access to dermatologists, to specialists, that's one thing, but reducing the time that they need to spend on, treatment, that's another thing that your platform helps with. Can you tell us a little bit more about how it actually does it?
So we don't have an application. You don't have to download an application. If you're a patient, you just go find us on AIPclinic.com. And there are 3 countries where we are fully available, in Hungary, in Spain, and in Slovakia. And we are launching our international expansion in Europe. So let's talk about Spain, for example. Spain has very long waiting lines for public healthcare in dermatology. So a lot of people have private health insurance. And even if you have a very good premium private health insurance, it's likely that you will get an appointment in 3 to 4 weeks. Now, instead of this, you go on AIPclinic.com/ES, and you'll create your profile with your national identity card. And create your profile in 5 minutes, and then submit a case where you take a picture, you fulfill a questionnaire, and then basically you wait a couple hours where on the other side, the doctor is going to look at your case in the queue. We'll look at the AI suggestion, and the system is organized in a way where they process the information much quicker than in a normal setting. And then they can choose from the prescription drugs, OTC drugs in a local country, like according to the local regulations. We are integrated into the e-prescription. So basically, depending on the country, you just walk into the pharmacy that's nearest to you, and you pick up your creams or your pills, whatever. This is saving a significant amount of time because there's no waiting in line. So you have a new case Tuesday morning, and you will have an answer by Tuesday afternoon. And what does it mean for patients? Patients that have very severe conditions, or they need treatment physically, or they need like intravenous antibiotics or whatever, we also give them the diagnosis, and we tell them, sure, you have to go to this place because it's a very urgent case. So this is roughly 30%. 30% of our patients, they require a follow-up in person, either because they need further investigation with a device like a dermatoscope, for example, which is especially used for moles, or they actually need an intervention. And but that means that 72% of people, they just sit on their couch waiting for the sit on the couch fulfilling their case, and then in a couple hours they have a peace of mind because they know, okay, well, I have this, or I have that, or I don't have anything, and I know exactly what to do. It's very typical of our patients to give a long history, not only of their medical condition, but also their lifestyle. And also if they try to use a different potion or a cream, whatever, they will say, oh, I used this and it worked, and for 4 weeks, and then for 2 weeks it didn't, etc. But also our dermatologists, they give lifestyle advice very often, and they look at this medical history, this extended medical history, and the answers are also quite extensive. And we created a small generative AI tool which helps doctors create their own panels that they can choose from, this templating system, which makes this part very fast, but at the same time also personalized. And at the end of the day, our patients get a premium service for a fraction of the normal price if they are insured. In some cases, of course, it's compensated by the insurance company, and much faster. I don't think that there is any alternative currently that offers you, like, within 24 hours a dermatology review this fast. Like, I'm sure that if you are really well connected, you can make it happen. The reality is that even in the US or in Canada, you would have to wait 3 to 6 months. You have to go through 2 rounds of referrals. You have to go see a GP, and then you can go see a dermatologist. And so this is a substantial increase in the quality of life for the patients as well.
And how do they see the fact that, you guys use AI in the process?
I guess that it doesn't really matter to most of our patients. There is a small fraction of patients that are disturbed by the fact that they get back the diagnosis and the treatment plan and the prescription within an hour. And sometimes if it's an ungodly hour, like midnight, then there's going to be a doctor who's hyperactive and they do the case in 11 minutes. And then most of our tickets in our support system are like, oh, this is a scam. There is no doctor behind it. But obviously, you cannot do a prescription without a doctor. All of our cases are attended by doctors, by dermatologists, no less. In different areas, especially in rural Hungary, for example, at the beginning when we started, it was not during the pandemic, but it was like 2 years ago. And at that time, AI was just becoming the hype it is today. And a lot of patients were indulged to some degree in conspiracy theories. So that didn't really happen. I think that it's important that the AI side is for the doctors. We are not really communicating it to the general population. We are communicating that to the doctors because it is them who are using it. A patient will never face the AI side of our product. We are not allowing them to access through an API and get their differential diagnosis, because then we would be solving any problems. No, we would just make the problem a bigger pile, because the problem is already that patients are self-diagnosing and the pipelines are completely stuck. You have to wait a lot, and then okay, we found a way around this. The doctor should be using the AI for not only also for like a more precise diagnosis, but a more precise diagnosis 35 times an hour. That's the real secret. And so I think that patients have early adopters among them who are absolute fans, and they use the service quarterly to check their skin lesions. And then there are people who are benefiting through their insurance companies who really love the product that way, because it is free. It's a benefit. They can use it 3 times a year in some cases with some companies. The overwhelming experience that we had is that 90% of the people love this type of medical product that's available from home. It's available without any complications. It's fully reliable. It's the equivalent of having gone to see a doctor. And if it's not, then they tell you to go and see a doctor. We did a pilot in Hungary with the public health system where we treated more than 20,000 patients. And it really proved 3 things for us. Number one, the societal approval of the product is overwhelming, is huge. People from every age group, every age bracket, they are using it. Females, males, teenagers, young adults, and we had 32 patients over the age 90. And so if you look at the demographic charts of Hungary, they basically mirror AIP's user chart. And that was one. The other was that, okay, the product actually works. And the third was that the doctors love using it as well. So we had this proof on the 3 most important topics or the 3 most important questions for us. And then we leaned into the expansion, creating the product so that we can be present in multiple countries in Central Eastern Europe, and also starting our expansion from Madrid, which is where I spend most of my time.
We're
So I
going to
would
talk about the expansion in a second,
yeah.
but I
Sorry.
want to ask you about some of the challenges, because what I have learned over the years when speaking to health tech startups and companies is that there's always challenges. So what are the challenges that you are facing as a company?
We are facing a lot of challenges, like any company would face challenges. I don't know what specifically to highlight from being a health tech company, because I guess that many health tech companies struggle with regulatory approval for their product,
Exactly.
which we spent a lot of time on that in 2021. And then we did it under MDD. And so now with MDR, we're going to have until the end of next year completed our process where we'll have 2A, MDR 2A. CE 2A. But I don't like, this is a box you have to take. This is not a real challenge for us. I guess that working with doctors and understanding that in healthcare, if you look at the market, it's the same pool of doctors that work for incumbent companies and for digital health companies. And if there's two incumbents, and they had invested each 100 million euros into building a brick and mortar facility, their limit of growth isn't going to come from the fact that they don't have the real estate. It's going to come from the fact that they are fighting for the tiny pool of doctors to fill those hours with. And we are working with large healthcare organizations in Slovakia and Hungary and Spain. And this is the same challenge. So we had to realize that the limit to our growth is going to be the bottleneck, the number of doctors that we can onboard. And so we focused on that 100%. I personally spent a lot of time lobbying our doctors throughout these countries. We attend conferences, we collaborate on papers, and we help their scientific advancement and give them a more flexible work schedule while earning substantial amount of money while traveling, for example, which is a great problem for especially younger doctors. They leave school either with or without a student debt, depending on which jurisdiction we are talking about, and they don't necessarily want to follow a career path that's going to lead to 20 years at the same place, and it will bring them close to burnout, which is a real problem. In the US, I think it's a huge mega tendency that the under 40 doctor population is leaving the profession in record numbers, but we see similar smaller tendencies in other European countries as well. And we are focusing on this balance where the company is going to be able to expand as quickly as possible and have very reliable, high quality medical professionals on board in every country where we are operating in. Finding this balance also on the pricing, on the compensation for the doctors, on managing the online and the physical space where, okay, we have a solution for 72% of the patients. So what do we do with the 30%? I would be much happier if all of the patients went to a doctor that's in the AIP global network that we verified. We work with them. We know what are the procedures, no, or better said, are they following the international procedures? Because very often smaller clinics do not use or do not adhere to the same procedures that the largest Semmelweis clinic in Budapest, for example, adheres to. And I think that finding your edge in this space as an innovator, it really depends on you delivering actual value on the AI side, on the integration side. You have to find out that what's the biggest value add for AIP to an insurance company. Well, it's the fact that we are integrated 100% into their EHR, also at the national level. The doctors can prescribe seamlessly to the cloud, if there is a cloud. In some countries, there are some, there isn't. And I think that at the end of the day, you really need to distill it down to, okay, you have to have a value package for the medical professionals. If they are with you, then you have to make sure that you have the best AI and you have the best back end, front end, everything. But without the doctors, it's meaningless because they will not use it. If they will use it and you have the other side as well, then you really got something. And what I'm seeing is that the biggest challenge is you have built all of this, you have the back end, the front end, you have the doctors. Now how you go to market, and the go to market is where healthcare companies will struggle the most, because the beneficiary of the product is not the same as the payer of the product. So you have to either find a surefire way to get patients at a relatively maintainable customer acquisition cost level, or have insurance companies. Now we are doing both. We are contracting insurance companies, huge organizations that employ their own doctors. But I think that we were the first one to accomplish a deal structure where we hire the doctors of an insurance company, because they test, I don't want the pain of managing the relationship with doctors, and you have a cool product I want to use, but I don't want to talk the doctors into using that. I will organize a series of events for you where you can talk to these guys in person. And so if you convince the doctors there and they join on board, then we have a deal. And we have done this multiple times. And I think that this is the biggest challenge, like to understand that no matter how well you define the problem and how good the solution is, you have to follow the money in healthcare. 80% of European healthcare is paid by the government. So there is obviously a much higher ratio of private practices in dermatology, like in dentistry. But still, Europe is also not one market. It's hugely different in Spain compared even to France. Even France and Spain are very different in the price points, in the waiting lines, in the funding structure for public-private insurance companies. If you look at Hungary and Slovakia, two wildly different systems. So I would think, now that you make me think, that's the challenge. Like, you really have to understand these cultures, the markets, how the countries work, what are the systems that you need to, it's not only the red tape, like you just need to understand, for example, the co-funding initiatives between a private and a public insurance company. And you have to position yourself as a medical service if you want to get paid, not as an AI tool, or like, you have to avoid to be in the cost center. You have to be in the profit center of an insurance company. And who are they paying? Well, they are paying the medical care delivery companies and individual doctors. That's how an insurance company is building its roster of many healthcare professionals, through companies and individuals that have the medical license. So we had to create those licenses for ourselves. And the most important prerequisite for that is that you have to hire the doctors locally. So eventually everything ties back to the doctors. That's why I started with that. But yeah, there are many ways how a company can get lost on the path in digital health, because you have all of the challenges that a traditional healthcare company would have. Plus, you have to be really on the top of your game with the product. Plus, you need to understand an entirely new world where every competitor you have has been in the space for 20 years at least. So, but I'm enjoying it very much. I think that we had, with my founding team, learned a lot in the last 3.5 years about healthcare. We are very fast-paced people. Everyone is very curious. So we have a partner, which is the second, maybe the third largest outpatient care delivery company in Hungary. They treat roughly 280,000 people a year. And the owner and founder, he's a doctor, he's an internist, András. He said that he has never seen two people getting to know the nitty-gritty details of healthcare delivery market so fast. And there's no other option. You really have to understand what you are competing with.
So all of that knowledge has helped you create the first cross-border hospital service. Is that correct? And that's where this expansion that you've talked about comes into place. You're talking about Spain, probably further afield, not necessarily only in Europe.
Yes, that's how we think about our existence in the world, like a digital hospital provider that's cross-border. We had a very interesting conversation at the beginning of our journey with a Romanian healthcare professional in Hungary at a conference, and he was complaining that there are tiny countries around in Central Eastern Europe, and everybody's trying to build everything on their own, and there's no cross-border services. Oh, yes. And I was already focused on the fact that yes, like, there are some very big investments that went into the e-health cloud, the EHRs, locally, like patient distribution systems, and none of this is being utilized at a cross-border level. And then I thought about this for a long time, like 2 3 months. What is the financially maintainable way of expanding? Because I have seen some big companies raise hundreds of millions of euros and then blow it all in their international expansion and then calling it quits in a new market. And I think that ultimately the financial structure with the doctors and insurance companies is what really enables you to, in a lean way, go into a new market, create your medical provider license, start building up a baseload volume of patients through insurance companies, and then you can focus on your B2C as well. So that's what we are doing. We have a service that's available as a cross-border service for any EU citizen on our international website. But our most important opening this next quarter is going to be in Spain, where we have hired, or I don't want to say hired, we have partnered with some of the most talented dermatologists who are also influencers on Instagram. And there's no such product like AIP Clinic on the Spanish market, which is crazy. If you think about it, I don't know how much you know Spain. Spain has a population of maybe 48.5 million, but the amount of people due to tourism at any given moment is going to be on average 50 million. So there's 50 million people. I would say that the private health insurance market is roughly worth 6 billion euros. And there are huge waiting lines for dermatology in most of Spain. And so we have a new campaign that we are starting roughly middle of April. And Spain is going to be the first large European country where our service is fully available with a local e-prescription, with local doctors. And most probably by the end of the year, we will have a network of dermatologists offering in-person visits as well. We're not going to stop there. We are having negotiation. I know that the UK is not the EU anymore, but we have had several.
But it's a huge market.
It's a huge market. It's very advanced from a digital health perspective. We have had several reach outs from some of the largest players on the market and individual dermatologists as well. France and Italy. Italy is probably the laggard in the digital health space. France and France is probably the most pioneering participant on the market, with several companies servicing tens of thousands of doctors with e-prescription and other tools from appointment booking to follow-ups and remote care monitoring, whatever. Our goal is to be in every major European market with local doctors by the end of 2025, and to expand our cross-border B2C with Hungarian doctors. Like we have a huge capacity to treat thousands of patients a day from Hungary, and call it like medical tourism, if you like. We had checked this with 2 large European law firms, and we are able to provide this service. But the experience so far is that this is a very difficult process to have an actual cross-border service where people trust in the brand and then they come from France to a Hungarian digital hospital. It's much easier for us to establish a company in France, AIP France, and have local doctors and have local French marketing and drive people to use this service. This is what we're doing in Spain. And so my experience is that in health, because at some point healthcare is going to become local. In our case, it's for 30% of the people. It has to be local because you have to go in person. You got to get in a cab, take the car, take the bus, whatever. That's another thing I didn't mention, but people don't have to worry about their working hours and manage to like get away for 3 hours to see a doctor. That's an important improvement. So having local minimum infrastructure, which is the company, the medical professional, and the license you have to have for the facility. Like everywhere we need to rent a medical clinic, despacho médico in Spanish, or like a unit which has been licensed as a facility. Then you have to hire the doctor. You basically have to comply with all of the local regulatory requirements, procedures. You have to pay the fees, etc. And in that way, it works. If you try to go international from a Hungarian company, but I bet you it's the same difficulty if you try to do it from Spain for the rest of Europe. I don't think that that's a sustainable structure. And I feel like companies that have tried that, not necessarily in healthcare, were not very successful. So we have combined a vision of a healthcare company and a AI company, and we are working in the workshop with the doctors. You're building the AI, but at the same time, we have this little ninja group that goes into countries. They facilitate the information flow so that we understand how doctors can sign a contract with you. Is it not exclusive if they have a public contract? What's the price point? What are like there's a myriad. I don't want to get into I don't want to bore the listeners, so like I don't want to too technical with this, but yeah, overall I think that I was already lost in the question that we were answering here, but
yeah, we're going in a few different directions, but I want to ask you about one more thing today, because throughout the whole chat that we've had so far, you mentioned the word partnerships and partners quite a few times, and I know that you have a fantastic partnership with Semmelweis University, but you've also become recently a partner of EIT Health, which is Europe's leading network of healthcare innovators. How do you see these partnerships, and what do you want to sort of achieve? What do you want to get out of these partnerships and collaboration as such? Because that is something I've also heard from you.
These partnerships are crucial for any company that wants to do something meaningful in healthcare. First of all, because these large university clinics treat so many patients, they have all this experience and all the data, and most probably the smartest doctors around. So if you want to build something globally, it's a great starting point. And I believe that we have some of this. I don't want to be modest about it. We have some of the best AI scientists in the world, and then Semmelweis University has some of the best dermatologists, cardiologists, purely because they have a very competitive environment becoming a doctor, and they see all types of cases all the time, because they have the misfortune of having to treat 1 million people with, I don't know, 40 doctors a year. EIT Health has been very helpful for us to kind of get a shortened path meeting these players of the ecosystem, an insurance company, another university. Healthcare is very peculiar. It's a very closed world. So if you have the ability to inject yourself into these, I don't even want to call them markets, let's just call new environments, through a partnership, through an ecosystem like EIT Health, that can save you years. And that's what we're experiencing. We had a conference where some of our team members attended in Lisboa, and now we are participating in a flagship project with the University of Lisboa dermatology department. With Semmelweis, we have a new landmark paper coming out in the next, I don't know, 2-3 months. And the doctors, they're always very proactive in finding new frontiers for innovation. So being in these partnerships means that we have the means to permanently innovate, get more data, understand what doctors need, like on the front line. And then on the institutional side with EIT Health, I guess that 90% of all the meaningful companies in Europe are part of the network. So it means that being in the same room can shorten your not innovation cycle, like your go-to-market cycle, your implementation. It can save you a substantial amount of time. So we're very happy about these partnerships.
Mate, thank you so much. This is a fantastic message, closing message for our today's chat. Best of luck, fingers crossed, and looking forward to making use of the service as well.
Thank you very much, Andrew. It was a pleasure to be here.